Amazing. Hi, everyone. So to kick things off, this is one of the few presentations where I didn't put an introduction to me slide, mostly because I think all of you know me, especially if you attended SSI. I was the one running around the collaborations workshop this year. You would definitely know who I am, but I am Sophia. My official job title is I'm a research community manager at the Alan Turing Institute, working on a project that has far too many acronyms. But at the end of the day, what I kind of wanted to talk to you about today was something that quite a few of the communities, both that I are engaged in my spare time, but also projects that I'm formally involved in, do. And it's this wonderful thing called collaboration cafes. So without further ado, I'm going to share my screen, hopefully to the correct screen. There we go. Amazing. So if I'm not in the wrong Zoom room, in the wrong place, and we're all not in the wrong Zoom room, this is the community building study group session for the SSI. And I wanted to chat about collaboration cafes today. So to kind of lead you and let you know what I'm going to be doing today is I wanted to introduce kind of what they are. Many of you may have attended them, but the concept, especially where they started, where my exposure to them started, and that was through the Turing Way community. I also wanted to share both the Turing Way and how they run collaboration cafes, but two other projects that I'm either involved in formally or that I volunteer with, and go through kind of the different iterations that we've seen there. There are a few times where I've called out when we've joined the struggle bus, or where collaboration cafes have really struggled for different reasons, and what I thought would be useful to kind of give an overview of my take and then lead to the discussion on is why potentially some things struggled, some collaboration cafes really worked and are still thriving, and why others kind of wrapped up after a matter of months. So I'll wrap up with, in my not so humble opinion, what I think really works when you have something that's styled like a collaboration cafe. So if that all sounds good to people, let's dive in. My exposure to the Turing Way and collaboration cafes really came at the same time. If you haven't heard about the Turing Way, it is an open source guide on data science. It's written collaboratively on GitHub, and it is both a book that is accessible, it's a resource guide, it is a global community of people. It is an open source project, obviously, because it's hosted on GitHub and anyone can contribute. And what it's really trying to do is shift a culture of closed science that's not always reproducible towards an open science, a collaborative big team science approach. And that's really a lot of the guidance that sits within the Turing Way. There are a few different books that currently exist, and we're also in the process of adding one on accessibility. And so you can find lots of resources about reproducibility for AI and data science projects, ethical research guides going all the way through research ethics committees, and also thinking about how to do data science ethically when we're scraping data from the internet, how we communicate different ideas, and also how you plan your projects. This project in the Turing Way really started kind of in 2019. Or 2018, 2019, I joined the community just as a little PhD student in 2020. And at the time, collaboration cafes were co-working, and they hadn't really fully formed into what they are now. And I think a big part of, as the project really grew, from its kind of original 10 members for 3 chapters who could host these kind of co-working calls where everyone knew one another, to then becoming this more global community, what it is today, with now over 134 active chapters with over 400 contributors. Collaboration cafes really became this place for serendipitous meetings, for co-working times. And this whole growth, I think, was really fed by the shift from co-working to collaboration cafes. There are a few kind of practices that were maintained throughout this shift, but at its heart, the Turing Way really thinks about how to develop resources, how to collate them, how to share them, and how to ensure that this community is global. So there is a localization and internationalization working group that focuses on translating different pieces of the Turing Way, and they have a separate collaboration cafe, as obviously the UK time zone doesn't work for everyone, and so there are many asynchronous streams as well as the synchronous sessions. So you've heard me say this word ad nauseum now, and it's not going to stop, but the collaboration cafes for the Turing Way are essentially these virtual co-working spaces that started from this kind of original co-working hour, which are held fortnightly, so twice a month for 2 hours. All of these calls have 1 to 2 or potentially more key facilitators from the core project team. And a key aspect of it is that there is a shared Pomodoro timer. So 2 hours is a really long time, especially if working on the Turing Way is not your day job. And so there is a drop-in policy, and the idea is that if there's a shared timer, anyone will be able to know what people are doing at any one point in time, and they can drop in for either a 25-minute sprint work or for a full hour and leave when they need to. All of those are kind of facilitated through the shared notes. Currently, they use FramerPad for shared notes, mostly because it is slightly more accessible than HackMD for screen reader technologies. And the idea is that these calls can be 4 people, they can be 2 people, the organizers, or they can be 20, 30, 40, 50 people. And the whole point is to try and reserve a time in people's calendars, similar to co-working, but reserve a time on people's calendars who aren't necessarily at the same organization, who aren't necessarily in the same time zone, for people to work on a thing together, to collaborate. And this really came from the idea of emergence as a strategy. So there is a really, really good overview from Forte Labs that gives an overview of kind of emergent strategy, more from the approach of social justice, but it does kind of capture the 9 key principles. But the one I think that Collaboration Cafe really addresses is point number 3. And that's the idea is that there is whoever's in the room are the right people, the right time, in the right place, because they are there. And that is what having this reserved time on the calendar is really about. So instead of needing to prepare a lot of meeting notes and prepare things ahead of time, it's just whoever is there on the day has a conversation, works on something, and then something great emerges from that. I think it's a really interesting way of approaching not necessarily meetings or brainstorming, but an actual space where whoever is there is coming with knowledge that doesn't require a huge amount of preparation, and then they can contribute and collaborate together. And it's unlike traditional co-working spaces, not physical spaces in the sense of like an hour on the calendar, where quite often it's set ahead of time of, oh, we're going to work on this presentation, or hey, we need to have this discussion. The idea of collaboration cafes is really, there is time, whoever shows up is whoever shows up, and you kind of run with that, and it is up to the facilitators to help guide conversations so that something can come out of that. So 3 kind of pieces that I wanted to cover today was first, the Turing Way, which really holds these collaboration cafes as virtual co-working spaces for community members to collaborate on work specific to the Turing Way, which could be absolutely anything, as the Turing Way is a community-driven, community-contributed project. The second one is a project that I'm part of in my day job, and it's called the AIM RSF, or the AI for Multiple Long-Term Conditions Research Support Facility. You may have heard me, I think 2 years ago with Irini, pitch the community building aspects of the AIM RSF, and we featured collaboration cafes to focus on knowledge sharing for the early career researchers amongst all the AIM consortia. Then the final kind of project that I want to touch on today is called AutSpaces. Now, AutSpaces is a citizen science platform that is focused at understanding sensory processing differences that autistic people experience. And the collaboration cafes that they featured really featured a little bit differently, and were called community collaboration sessions. They were opportunity for some of the core team to share out about work, share out about daily lived experience, and they were also highly featuring working on the platform. or the project itself during the monthly sessions. So to jump into AIM, just heard me talk about the Turing Way. So AIM project itself, to kind of situate yourself in this community. The AIM project is all about using data science and AI techniques, as well as combined lived experience, expertise, social science, and healthcare knowledge to understand multiple long-term conditions, how they occur within a life course, how we can treat them, how we can better care from a really holistic point. And it's a project that is supported by the NIHR. The collaboration cafes, as you just heard me mention, really focused on the early career researchers. So we learned from the Turing Way, and we also held 2-hour drop-in sessions, in addition to 1-hour or 50-minute monthly community lunches that were focused on specific parts of the community. So Collaboration Cafe for the AIM-RSF project really was trying to sit and host and focus on these early career researchers, where they could bring work, they could collaborate on methods, they could share the knowledge that they have, and hopefully help each project out as they were running into many of the same issues. What ended up happening is that these community sessions ended up being attended by a full kind of spectrum, a full snapshot of the community, which had the benefit of supporting networking for some of the early career researchers who were then looking to build a career in academia, but also kind of came with its own struggle bus moments. So there were many different themes. You know, the project that I've just described is obviously massive. And if you heard me talk last year, the collaboration cafes were a really big part of the initiative in theme 3. Which was all about community building, training, upskilling, sharing knowledge, really focused on these early career researchers. Now, early career researchers could be PhD students, postdocs, but they could also be newly trained clinicians and physicians, anyone who was in the early stages of the career and really would have benefited from building a supportive, open, kind network of fellow academics or fellow clinicians. This community obviously is massive and not just the early career researchers themselves, but also their PIs, their colleagues. In order to do such a large project, you needed quite a lot of people involved. And when I said that, there was a full snapshot of the community that ended up attending these collaboration cafes. What I mean is that we had involvement from NHS trusts, from speech and language therapists, from people living with multiple long-term conditions and many different multiple long-term conditions and their support people, their families, their carers. We worked with a lot of charities, and some of them would pop along to these collaboration cafe sessions to understand what they were about. And as well, we often had some senior academics and PIs come in for the conversations. These projects were also all spanning. So when we talk about the AIM project itself, we were the research support facility aimed at kind of tying together and helping to facilitate collaboration, facilitate network building, and also to facilitate the sharing of knowledge across 7, it's now 8 consortia. I like to say it's a consortia of consortiums, or if you read Terry Pratchett, it's consortia all the way down. With this project, they all had very different, although some overlapping interests and focuses. So some of them were looking at identifying clusters of diseases that tend to occur together, or could occur together, or could occur one by one and then develop into a cluster later on. There were some projects that were looking at lifespan, so they're using some causal modelling to understand at what point in the life course different conditions occur, and is there anything that kind of causes a little bit of a domino effect. There are teams that were looking at really holistic, so everything that comes in from neonatal care all the way through to life course challenges, and so general illness, low socioeconomic areas, and access to healthcare. Then you had others that were really focused on polypharmacy and looking at drug-to-drug interactions. and if anything can be done to improve the prescribing of multiple medications to manage multiple long-term conditions. So as you can kind of see from this slide and the previous slide, there was a massive spread of people that were involved in these projects. It all started at slightly different times, that were all at slightly different levels of maturity. And that kind of brought us to a little bit of a struggle bus moment. If you haven't heard the struggle bus before, sometimes when you're just struggling, you just got to ride it out. So you're just on the struggle bus and eventually you'll reach the destination. So where collaboration cafes, I think, struggle with the AIM RSF were their expectations of what would happen in that hour, that half hour, or the 2 hours, depending on someone's seniority of where they were in their career. So we had a very senior academic who was quite happy coming to sessions that didn't have an agenda, where they could discuss ideas and work on things. And then we had other people, especially those who were working as physicians, as in their GP practice, who needed agendas for meeting, who were really, really strapped for time. And so trying to get everyone in a common space for collaboration, but also just for trust and for full conversation, which kind of needed to precede collaboration. It was quite a difficult point that I think Collaboration Cafe for the AIM RSF struggled with in the beginning. And because of that, the emergent strategy and the emergent projects, the overlap, didn't really get identified the same way as it did in a project such as the Turing Way, because even if you had the right people who were all at Collaboration Cafe, because their projects were on such different timelines, things couldn't necessarily be acted upon for 8 months, or maybe it came 2 months too late for different teams and different people. And I think the timelines and the spread of the project meant that the synchronicity that Collaboration Cafes brought was actually more of a disadvantage than it would be an advantage for people having a reserved time in their calendars. We also had a massive overload of events, especially for these early career researchers who are attending a lot of their own project meetings, doing a lot of the analyses, writing for grants, continuing on the project. They had monthly lunchtime sessions as well, where they would practice, their own presentations before going to a conference. There was a lot of upskilling and learning that needed to be done, so there were a lot of workshops. At the end of the day, having another 2-hour block every single month on a calendar placed a really, really high demand on the time for early career researchers. And they were one of the groups that started dropping off the first, even though that the collaboration cafes were really trying to, we're really focusing on them and trying to build their community up from its kind of core aims. In order to combat that, we pivoted a little bit and we prepared topic or specific sessions so that people who were really interested in data visualization, so would have 1 month on data visualization for collaboration cafes, and Irene would work really hard to ensure that there were workshops that complemented collaboration cafes, so people would hopefully then bring their own data that they're struggling with, come to the workshops, and then come to collaboration cafe to collaborate and to work with one another. But that kind of created more of an effect of really low numbers, because it required people to be even more so at the same point of their research or at their analyses as other people, and also have the same interest. And so it went from maybe 10 people who were kind of there but a little disengaged, maybe only 3 people who could really do something in those sessions. And that was kind of one of the core struggle buses that these collaboration cafes for the AIM RSF found. So the third kind of iteration, or the second one other than the Turing Way that I wanted to talk about, was a project called Aught Spaces. And if you've heard any of the presentations from Georgia, who's also an SSI Fellow, this is her kind of core project. So Aught Spaces, again, is another acronym, but this is more of a reflexive one. So it stands for Autism Research into Sensory Processing for Accessible Community Environments. And at its heart, it's a participatory or a community science, citizen science research project to co-create an open source citizen science platform or a website where people could share their lived experience, share recommendations, and start to understand from the research side what are these kind of differences and what policy recommendations can be made. So a big example is that the tube, if anyone's kind of visited London or lives around London, there are some lines that are much more brighter and so much louder than others. Hospital waiting rooms are another one, and because 90% of autistic people process sensory information differently to non-autistic people, but the question is, we know that it's different, but different how, and then what can we actually do about it to make the world, to make our environments more accessible to more people. So the collaboration sessions, our collab cafes, really changed a little bit more into, got rebranded into community sessions or community meetups, where the focus was heavily on creating an accessible and inclusive way of working on the project to understand what the community needs to work on the project. And then also as it actually got up and running to work on the project itself. So it was developed or is being developed on GitHub, but it had to feature a really strong reliance on non-technical kind of communication channels, so not just doing pull requests. So using Slack as well as email, as well as newsletters, as well as Gitter, as well as these community sessions to ensure that everyone in the community who really wanted to be involved would have a channel that they could get involved in the project through. So they were kind of rebranded a little bit as community co-working sessions. That were an active practice of inclusive working, but also co-working itself to support a neurodiverse community. And the kind of key pieces to do that really fell quite heavily on Zoom facilitation. So we would have the kind of the main Zoom room. So sessions were 2 hours once a month. These main breakout rooms would be for general conversation, but also onboarding new members, as we had people who may have never heard about it before, who may have been recommended it, and sort of onboarding them into what we were trying to do, how we worked, could we change anything, and all that would be held in the main room, and then using breakout rooms for really specific pieces of work. The kind of core team would plan sprints, so we'd loosely adapted agile workflows to try and overview what we could potentially be doing, and so that would much more support an agile or a flexible way of working, so that each month there would be these kind of work blocks that could be worked on that could either be broken down in 2 weeks, so that we could get a session at the start of the month and then at the end of the month, and also to understand what specific piece of work could be done depending on who was there on the day, so that there could be really flexible work streams that weren't holding anything up. The community sessions became a really kind of key pillar for both the project and the community, knowledge transferring both from the research and the core team, all of the allies that were working with us, to understand how to work accessibly, what this project needed, what it needed to look like, how we would communicate, as well as then upskilling lots of the community into a tool like GitHub, setting up email, helping people set up email addresses so that they could subscribe to the newsletter, and a lot of kind of the pieces were really focused on, I feel like I've used that phrase a lot, sorry, I was like, I'm hearing myself talk back now. A lot of the pieces were really focused on transferring knowledge from autistic people and the researchers, and going both ways. And so a big part of the actual collaboration cafes, or these community sessions, featured share outs about, oh, this happened in this person's day, and therefore like this is what we could be doing in this thing, and it really grew into a really supportive and inclusive space, which was amazing. The struggle bus of all of this, of course, was that it really needed a lot of strong facilitation to support the community and to support breakout rooms, because again, this is a collaboration cafe style, so we don't necessarily know who's going to show up on the day. So you did need to be prepared to have potentially 4 breakout rooms and therefore 4 facilitators plus kind of a core host or chair who could facilitate the onboarding and also the conversation in the main room. So we did find that it was quite heavily weighted on making sure that supporters and facilitators were available for the entire 2-hour duration. It also required a really strong onboarding into the project itself. So unlike the Turing Way, where you could kind of show up and you didn't need to know about the Turing Way, but you could kind of roll with it and you could have conversations. It was a lot more emergent because there was something that was kind of already set in stone, although loosely so. We needed to ensure that everyone who was newer and would join kind of influx at any point in these calls would understand where we were in the conversation, would understand what was kind of expected from them as contributors, both on the call, but for the project itself. And this also led to how momentum would stall quite often, because for many people, the co-working hours or these community sessions, this collab cafe, was the only time that they would think about Space's project, and that was the only time where the project itself would get worked on. And so this is a project that's really kind of evolved as the community has been able to evolve, been able to grow, sometimes shrunk and then grow again. It's really waxed and waned. It also, and all of that is kind of reliant upon a really findable, really accessible and an open workflow way of working, and also a plan so that at any point someone can jump in and notice that they have this work skill and they can contribute. But even if they just wanted to come along, that knowing that there would eventually be a conversation, and that being in the room meant that you would be contributing to the project in some way. But knowing how to communicate that was quite a difficult part of this iteration for collab cafes. So to kind of recap and draw the parallels, this is the what I think work in my not so humble opinion, or sometimes very humble, because these projects are I absolutely stand on the shoulders of giants regarding these projects. So the Turing Way did have this established community, even though it did start with 10 people. Reproducibility is such a big issue, communication and education. So it's really a community that could grow so quickly around a core idea. And because the Turing Way itself was community driven, it emerged from the ideas from the people in the room saying, oh, that could be a chapter in the Turing Way, I can contribute this thing. It meant that the project itself could grow because people were there. There was always something to discuss or something to work on, even if you were just there listening in and then forming opinions and being able to share those back. There was something that was curated to be worked on in those collaboration cafes. And again, I know I've mentioned this a few times, but having those kind of 2-hour blocks really reserve time and facilitated serendipity, if you could facilitate such a thing. Again, having people, bumping into people, having ideas and conversations was something that I think I've seen so many times and been so inspired by so many collaboration cafes for the Turing Way because of that. Now, the AIM-RSF collab cafes only ran for just under 1.5 years. And again, a lot of that was kind of learning and adjusting to the project, because the 7 research consortia had very little overlap on their timelines, and also where the researchers were in their own careers and their own journeys, what they were able to work on. And obviously, because we work in a research environment or academia where there is still a really big narrative around being scooping, not sharing your results, closed research practices, especially within kind of healthcare medical research, it was a really long slog to kind of fight against that and to build trust and collaboration and build a foundation that open researchers could. Register reports are really good and you can do this thing, so working openly can actually help stop you from getting scooped. And so I think it was quite a difficult battle to say, hey, we're going to have this 2-hour right from the get-go for people to collaborate, when everyone was like, I don't want to collaborate, I want to win a prize. And I think having that foundation is really key for any collaborative space. And finally, kind of the lessons learned from Aut Spaces is that having these really flexible session types was so important to make the community session successful. And quite often it would need to shift from kind of community science, citizen science, kind of into user testing of what would this look like, what would that look like, what could we build, in order to kind of maintain a really supportive community space, and uphold kind of the embedding of true community science. It did need to be really, really flexible. So kind of there is a strong overlap between the Turing Way in Aut Spaces in that the project doesn't progress unless people are there progressing it, contributing and doing work. And it didn't necessarily, for both these projects, it doesn't matter what that is, because people are in the room, therefore they are doing something, and they are thinking, they are talking, they are making a pull request, they are designing something. And because these spaces existed in both of these projects, therefore I think I can, in my not so humble, I'll put my stick in the ground and say, because people are there in the room contributing, therefore these projects grew and existed. I talk quite a lot about free pizza, in the sense that if people are volunteering their free time when they could be napping, when they could be going for a walk outside, they could be doing anything they want, bringing them to a space where they then have to do something. I talk about, well, what's the free pizza? Because when I was in college, you'd go to all these events. I was like, why am I going to this event where I get some sit and I'm told and I could be at home, but that event had free pizza. So of course I go. I'm a broke student. I'll never turn down free pizza. And I think about this when I think about community, is like, why are they there? What are people getting out of? Because you as a project are obviously going to grow and, get something out of people attending your sessions. But in return, what's the free pizza equivalent for that community? And I think both the Turing Way and also Aut Spaces have these really strong free pizza offerings, whether that's a sense of community. And both of these, you can share your experience, but you can also see kind of a tangible outcome from that sharing, from your involvement. And both the projects had really specific little work pieces, and there was this shared knowledge that came from this community that didn't really require people sitting down for half an hour or up to 4 hours thinking about, okay, I need to get these documents in order, this is what I need to do. I need to make sure that if I'm coming to share my data analysis, that all my variables are labeled correctly, that all my code's documented. And ultimately what we were asking people to do when to come to AMRSF collaboration cafes, we were asking also quite a lot of background work in order to share what could be done. They needed to check, could I even share this data? Who can I share this with? Does that mean I don't get authorship if I work on it collaboratively? And I think a lot of these big pieces had not really been, not necessarily thought about it, but it was a different type of project because the AMRSF was already kind of in flux, and it wasn't a community driven, wasn't an emergent project at its core. I think that's my takeaway from today, is that collaboration cafe spaces work best when the outcome does not matter. And the outcome is entirely then decided by the people in the room, as opposed to needing to kind of be on this train. So thank you for listening to all of this. If you have any questions, let me know.